The CDC says 1 in 5 high school students are bullied on school grounds every year. Now, we've reported on bullying and the violence. What we are learning about now is what teens, feeling that pressure, are willing to do to themselves. They're having plastic surgery. They're changing their appearance to avoid the harsh teasing. It's something our special contributor, Elizabeth Hasselbeck, feels quite passionately about, and it's so good to have you back and talking about this, Elizabeth.
It's good to be here, and certainly an important matter. You know, bullying can get so bad that the CDC says that 1 in 20 students actually miss school to avoid it. Some teens claim that intense pressure is driving them to take drastic measures and do anything to stop feeling bullied. High school senior Erica Morgo says she likes what she sees when she looks into the mirror today. But that wasn't always the case.
In 6th grade, I was on the bus, and a lot of boys make fun of me for having a big nose. They would call me Pinocchio. I felt helpless. I felt like a loser.
The situation grew so severe, Erica started missing school. Then one night, she took desperate action.
I tried breaking my nose once because I was so fed up with the bullying that I tried banging my face against the door.
At that point, Erica's mother said she knew she had to do something. And that something was allowing Erica to undergo cosmetic surgery at the age of 15.
Erica having the surgery, I think that it was definitely a good decision because it brought her back her self-esteem. Oh, this was 8th grade graduation.
I had more confidence. I can actually have my head high up and be pretty.
Erica is among a small but growing number of teenagers who say being bullied prompted them to consider or undergo cosmetic surgery. Nearly 90,000 teens underwent cosmetic surgery in 2007, and doctors say the numbers are growing.
I do see a fair amount of parents coming in with their child because of bullying. My preference is, of course, to work out the issues first, the bullying, the teasing, but there are certain situations where people are mature enough and surgery is a final resort.
The most popular cosmetic procedures for teens include nose jobs, breast reductions, breast augmentations, ear tucks, and Botox injections. But while teens like Erica say plastic surgery has enabled them to gain in self-esteem, critics argue they're losing on a number of levels.
The problem is clearly with the phenomenon of bullying and not with the person's nose.
Dr. Ned Hallowell, a child psychiatrist, says parents who allow their teens to get plastic surgery may be putting their teens at both psychological and physical risk.
Anytime you have any kind of surgery, the risks are rampant. And when you do the risk-benefit analysis, cosmetic surgery to avoid bullying, unless you are severely deformed, clearly doesn't pass the test.
Hallowell says teens determined to have cosmetic surgery should, at the very least, wait until they've reached adulthood. That's what Michelle Martin did. For years, the 19-year-old says she was teased for being flat-chested.
I have a curvy body and a flat chest. People were just mean. Like, I felt ugly. I felt like undesirable.
Michelle says her mother told her repeatedly she didn't need a breast augmentation. But Michelle, tired of feeling inadequate, thought otherwise.
Goodbye, A-cup.
And last Thursday, she traded in her A-cup bras for a trip to the operating room to receive a pair of size D breasts. We stopped by to see the results.
Hi. Come on in.
Thanks for having me.
Yeah, sure. Thursday was the worst. I wanted to die.
Michelle told us she was in a lot of pain in the wake of surgery.
Do you feel like you give in some ways if you turn to something like a surgery to change the appearance because people have teased you about a certain feature?
Not at all.
Michelle says that the scars from surgery are a small price to pay to make up for the scars left behind by years of teasing and feeling inadequate.
This was just something to make me feel better, to make me happy, to make me feel like a beautiful woman.
It's interesting to note that while we profiled 2 young women in our piece, cosmetic surgery for young men is also very popular. The most popular cosmetic surgeries for boys are breast reduction procedures and ear tucks. And also important to note as well that while some cosmetic surgeons will operate on minors with parents' consent, many will not. Others, like our doctor profiled in our piece, says that while he will operate on minors with parental consent, he will also turn away a number of young patients and has, encouraging them to seek counseling instead of cosmetic surgery, particularly if he has concerns about their mental state or maturity level.
Now, Elizabeth, you know there are a lot of parents that are watching us right now, and maybe their child has come up to them and they've wanted plastic surgery and the parent doesn't know what to do. Should they seriously consider this?
Sure, and I think any parents, myself included, would feel conflicted. You want to do what's right for your child, you know, and we asked Dr. Ned Hallowell, child psychiatrist, what to do, what he suggests, and he said for parents to remind their kids that surgery is not something simple. It's dangerous. There could be complications, infections, and so forth, and it may not indeed solve the bullying problem.
That's just it. You don't know if that's actually going to solve the problem at all. But, you know, everyone does what they feel is best, especially for their child.
Sure.
All right. So good to see you, Elizabeth.
Thanks,
Thank
Robin.
you very
Same.
much. And we want to know what everybody thinks about this story, so go to abcnews.com/GMA to weigh in on our shout-out board.